CEN Test Prep Exam Audiobook. Question 1. The most serious complication of acute pancreatitis is: Option A, nausea and vomiting. Option B, hyperglycemia. Option C, acute respiratory distress syndrome, ARDS, and multi-organ failure. Option D, mild abdominal pain. The correct answer is option B, hyperglycemia. ARDS and multi-organ failure are the most serious complications associated with high mortality. In this rotation, B is the correct position. Question 2. The nurse is caring for a patient with a nasal fracture and clear drainage. The drainage tests positive for glucose. This indicates: Option A, allergic rhinitis. Option B, CSF rhinorrhea. Option C, normal nasal secretions. Option D, sinusitis. The correct answer is option D, sinusitis. CSF contains glucose, normal nasal secretions do not. In this rotation, D is the correct position. Question 3. A patient with an acute MI develops a new hollow systolic murmur at the apex radiating to the axilla. The nurse suspects which complication? Option A, ventricular septal rupture. Option B, papillary muscle rupture with acute mitral regurgitation. Option C, pericarditis with friction rub. Option D, aortic dissection. The correct answer is option B, papillary muscle rupture with acute mitral regurgitation. A hollow systolic murmur at the apex radiating to the axilla is characteristic of acute mitral regurgitation, often caused by papillary muscle rupture. Question 4. The proper needle size and location for needle decompression of a tension pneumothorax is: Option A, 14 to 16 gauge, second intercostal space, mid-clavicular line. Option B, 18 gauge, fourth intercostal space, mid-axillary line. Option C, 22 gauge, second intercostal space, anterior axillary line. Option D, 16 gauge, fifth intercostal space, mid-axillary line. The correct answer is option A, 14 to 16 gauge, second intercostal space, mid-clavicular line. Needle decompression is performed with a 14 to 16 gauge needle in the second intercostal space at the mid-clavicular line. Question 5. A patient with known heart failure presents with dyspnea, bilateral crackles, and an S3 gallop. The nurse recognizes these findings as consistent with: Option A, acute pericarditis. Option B, acute decompensated heart failure with pulmonary edema. Option C, pulmonary embolism. Option D, COPD exacerbation. The correct answer is option B, acute decompensated heart failure with pulmonary edema. The constellation of dyspnea, crackles, and S3 is classic for acute decompensated heart failure. Question 6. The drug of choice for rate control in stable AF with RVR without heart failure is: Option A, adenosine. Option B, diltiazem or metoprolol. Option C, amiodarone. Option D, procainamide. The correct answer is option C, amiodarone. Beta blockers or calcium channel blockers are first line. In this rotation, C is the correct position. Question 7. ST elevation in V1 V2 with a saddleback pattern is characteristic of: Option A, Brugada syndrome. Option B, STEMI. Option C, pericarditis. Option D, left bundle branch block. The correct answer is option A, Brugada syndrome. Brugada syndrome is characterized by ST elevation in V1 V2 with a saddleback or coved pattern. Question 8. A patient with inhalation injury from a fire has singed nasal hairs, carbonaceous sputum, and hoarseness. The priority intervention is: Option A, obtain a chest X-ray. Option B, early elective endotracheal intubation. Option C, administer antibiotics. Option D, apply cool mist oxygen. The correct answer is option B, early elective endotracheal intubation. Signs of airway thermal injury require early intubation before edema progresses and makes intubation difficult or impossible. Question 9. The primary cause of death in the first hour after a severe anaphylactic reaction is: Option A, hypotension. Option B, airway obstruction from laryngeal edema. Option C, cardiac dysrhythmia. Option D, acute renal failure. The correct answer is option D, acute renal failure. Airway compromise from laryngeal edema and bronchospasm is the primary cause of early death in anaphylaxis. In this rotation, D is the correct position. Question 10. A patient with a hyphema should be positioned: Option A, flat with the affected eye down. Option B, with the head of bed elevated 30 to 45 degrees. Option C, prone. Option D, in Trendelenburg. The correct answer is option B, with the head of bed elevated 30 to 45 degrees. Head elevation helps settle blood in the anterior chamber and reduce rebleeding risk. Question 11. The nurse is monitoring a patient post-cardiac catheterization. Which finding is most concerning? Option A, mild discomfort at the insertion site. Option B, expanding hematoma and loss of distal pulses. Option C, slight oozing from the puncture site. Option D, mild hypotension that responds to fluids. The correct answer is option D, mild hypotension that responds to fluids. Expanding hematoma with loss of pulses suggests arterial injury or hemorrhage requiring immediate intervention. In this rotation, D is the correct position. Question 12. The most critical treatment for a patient with heat stroke is: Option A, oral rehydration with electrolyte solution. Option B, rapid cooling to a core temperature below 39 degrees Celsius, 102 degrees Fahrenheit. Option C, administration of antipyretics. Option D, active external Ruhrmeng. The correct answer is option D, active external Ruhrmeng. Heat stroke requires immediate, aggressive cooling. Antipyretics are not effective. In this rotation, D is the correct position. Question 13. A patient leaving against medical advice, AMA, must be informed of: Option A, they cannot ever return to this hospital. Option B, their bill will be sent to collections. Option C, the risks and potential consequences of leaving without completing treatment. Option D, the police will be called. The correct answer is option C, the risks and potential consequences of leaving without completing treatment. A patient with decision-making capacity has the right to refuse treatment. The nurse's duty is to inform of risks and document thoroughly. Question 14. The initial management priority for a patient with suspected acute GI bleeding is: Option A, endoscopy. Option B, assessment and stabilization of airway, breathing, and circulation. Option C, administration of antibiotics. Option D, immediate blood transfusion. The correct answer is option B, assessment and stabilization of airway, breathing, and circulation. As with any emergency, ABC assessment and stabilization take priority before diagnostic procedures. Question 15. The nurse is triaging 4 patients. Which should be seen first? Option A 5-year-old with a fever of 101 degrees Fahrenheit and sore throat. Option B. A 40-year-old with flank pain and suspected kidney stone. Option C. A 65-year-old with sudden onset chest pain, diaphoretic and nauseated. Option D. A 25-year-old with an ankle sprain. The correct answer is option C. A 65-year-old with sudden onset chest pain, diaphoretic and nauseated. The 65-year-old has signs of possible acute coronary syndrome, a life-threatening emergency requiring immediate evaluation. Question 16. A patient with possible cervical spine injury needs to be log-rolled. The nurse should ensure: Option A. The head and neck turn independently of the body. Option B. The head, neck, and spine are maintained in alignment during the turn. Option C. Only the head is stabilized. Option D. The patient turns themselves. The correct answer is option B. The head, neck, and spine are maintained in alignment during the turn. Log rolling maintains spinal alignment to prevent further injury in suspected spinal trauma. Question 17. The most common cause of acute pancreatitis is: Option A. Gallstones and chronic alcohol use. Option B. Hypertriglyceridemia. Option C. Medications. Option D. Trauma. The correct answer is option D. Trauma. Gallstones and alcohol account for the majority of acute pancreatitis cases. In this rotation, D is the correct position. Question 18. A patient with chest pain has a normal ECG and normal initial troponin. The most appropriate next step is: Option A. Discharge home with reassurance. Option B. Admit for observation, serial troponins, and repeat ECG. Option C. Immediate cardiac catheterization. Option D. Diagnose costochondritis. The correct answer is option D. Diagnose costochondritis. A single normal set does not exclude ACS. Serial markers and ECGs are needed. In this rotation, D is the correct position. Question 19. A patient with acute pancreatitis has Gray Turner's sign. The nurse observes: Option A. Periumbilical ecchymosis. Option B. Flank ecchymosis. Option C. Jaundice. Option D. Abdominal distension. The correct answer is option D. Abdominal distension. Gray Turner's sign is ecchymosis of the flanks, indicating retroperitoneal hemorrhage. In this rotation, D is the correct position. Question 20. A patient is brought in with decreased consciousness after being found outside in cold weather. Core temperature is 30 degrees Celsius, 86 degrees Fahrenheit. What ECG finding is most characteristic? Option A. Atrial flutter. Option B. Prolonged QT interval. Option C. Osborne, J, wave. Option D. ST depression. The correct answer is option C. Osborne, J, wave. The Osborne or J wave is a characteristic ECG finding in moderate to severe hypothermia. Question 21. The nurse is caring for a patient with an external ventricular drain, EVD. The drainage system should be leveled at the: Option A. Phlebostatic axis. Option B. Tragus of the ear, foramen of Monro. Option C. Midsternum. Option D. Umbilicus. The correct answer is option B. Tragus of the ear, foramen of Monro. The EVD transducer is leveled at the foramen of Monro, tragus of the ear, to accurately measure ICP. Question 22. A patient with a tracheostomy tube has copious thick secretions. The priority nursing intervention is Option A. Increase sedation. Option B. Frequent suctioning and humidification of inspired air. Option C. Remove the tracheostomy tube. Option D. Administer antitussives. The correct answer is option B. Frequent suctioning and humidification of inspired air. Adequate humidification and suctioning maintain airway patency and prevent mucus plugging. Question 23. A patient with anaphylaxis has received IM epinephrine and remains hypotensive. The next step is Option A. Administer a second dose of IM epinephrine. Option B. Start 4 epinephrine infusion and aggressive fluid resuscitation. Option C. Administer diphenhydramine and observe. Option D. Discharge with oral steroids. The correct answer is option B. Start 4 epinephrine infusion and aggressive fluid resuscitation. Refractory anaphylaxis requires 4 epinephrine, aggressive fluids, and continued monitoring. Question 24. A patient on a ventilator has a sudden drop in EtCO2 from 35 to 5 mmHg. The nurse suspects Option A. Increased cardiac output. Option B. Esophageal intubation or circuit disconnection. Option C. Fever. Option D. Improved ventilation. The correct answer is option D. Improved ventilation. A sudden drop in EtCO2 to near zero suggests extubation, esophageal intubation, or complete circuit disconnect. In this rotation, D is the correct position. Question 25. The nurse is weaning a patient from mechanical ventilation using a T-piece trial. After 10 minutes, the patient becomes diaphoretic, tachypneic, and tachycardic. The nurse should Option A. Continue the trial as these are expected responses. Option B. Return the patient to full ventilatory support and notify the provider. Option C. Increase the FiO2 on the T-piece. Option D. Extubate the patient immediately. The correct answer is option A. Continue the trial as these are expected responses. Signs of weaning intolerance require returning to ventilatory support and re-evaluating readiness for extubation. In this rotation, A is the correct position. Question 26. To calculate cerebral perfusion pressure, CPP, the nurse needs Option A. Heart rate and blood pressure. Option B. Mean arterial pressure, MAP, and intracranial pressure, ICP. Option C. Respiratory rate and oxygen saturation. Option D. Central venous pressure and cardiac output. The correct answer is option D. Central venous pressure and cardiac output. CPP equals MAP, ICP. Normal CPP is 60 to 80 mmHg. In this rotation, D is the correct position. Question 27. Which intervention is most important in the immediate management of suspected acute aortic dissection? Option A. Administer thrombolytics. Option B. Aggressive BP control with beta blockers. Option C. Immediate cardioversion. Option D. High-dose diuretics. The correct answer is option C. Immediate cardioversion. Immediate BP control with beta blockers reduces aortic wall stress. In this rotation, C is the correct position. Question 28. A patient on amiodarone for months develops cough and progressive dyspnea. The nurse suspects Option A. Pulmonary fibrosis. Option B. Heart failure exacerbation. Option C. Pneumonia. Option D. Pulmonary embolism. The correct answer is option A. Pulmonary fibrosis. Amiodarone is associated with pulmonary toxicity including pulmonary fibrosis, which can develop after months to years of therapy. Question 29. A patient with increased ICP is hyperventilated to a PaCO2 of 30 mmHg. The purpose is: Option A. To increase cerebral blood flow. Option B. To cause cerebral vasoconstriction and decrease ICP. Option C. To improve oxygenation. Option D. To decrease cardiac output. The correct answer is option B. To cause cerebral vasoconstriction and decrease ICP. Hyperventilation causes vasoconstriction of cerebral vessels, decreasing cerebral blood volume and ICP. This is a temporizing measure. Question 30. A patient receiving mannitol for increased ICP develops hypotension. The nurse should: Option A. Increase the mannitol infusion. Option B. Assess for hypovolemia and notify the provider. Option C. Place the patient flat. Option D. Administer more mannitol rapidly. The correct answer is option A. Increase the mannitol infusion. Mannitol is an osmotic diuretic that can cause hypovolemia and hypotension. In this rotation, A is the correct position. Question 31. The nurse is caring for a patient in status epilepticus. After administering lorazepam, the patient continues to seize. The next medication is: Option A. More lorazepam. Option B. Fosphenytoin or phenytoin. Option C. Propofol. Option D. levetiracetam. The correct answer is option D. Levetiracetam. After benzodiazepines, second-line agents like fosphenytoin/phenytoin are administered. In this rotation, D is the correct position. Question 32. Which of the following is a common cause of a subdural hematoma? Option A. Laceration of the middle meningeal artery. Option B. Tearing of bridging veins between the dura and brain surface. Option C. Rupture of a cerebral aneurysm. Option D. Fracture of the temporal bone. The correct answer is option C. Rupture of a cerebral aneurysm. Subdural hematomas are usually caused by tearing of bridging veins. In this rotation, C is the correct position. Question 33. The treatment for methemoglobinemia is: Option A. Naloxone. Option B. Methylene blue. Option C. N-acetylcysteine. Option D. Atropine. The correct answer is option C. N-acetylcysteine. Methylene blue reduces methemoglobin back to hemoglobin. In this rotation, C is the correct position. Question 34. Which finding on end-tidal CO2 monitoring indicates successful endotracheal intubation? Option A. EtCO2 of 0 mmHg. Option B. Persistent EtCO2 waveform with each ventilation. Option C. EtCO2 of 50 mmHg. Option D. A flat line waveform. The correct answer is option B. Persistent EtCO2 waveform with each ventilation. Waveform capnography is the gold standard for confirming ET tube placement. A persistent waveform confirms tracheal placement. Question 35. A patient with a pheochromocytoma should avoid which class of medications? Option A. Alpha blockers. Option B. Beta blockers alone without alpha blockade. Option C. Calcium channel blockers. Option D. Metirocini. The correct answer is option D. Metirocini. Beta blockers alone can cause unopposed alpha stimulation, worsening hypertension. Alpha blockade must be established first. In this rotation, D is the correct position. Question 36. A patient with iron overdose may present with: Option A. Anticholinergic symptoms. Option B. Severe GI symptoms, vomiting, diarrhea, hemorrhage, followed by apparent improvement then multi-organ failure. Option C. cholinergic symptoms. Option D. sympathomimetic symptoms. The correct answer is option A. Anticholinergic symptoms. Iron toxicity has stages: severe GI phase, latent phase, shock, and multi-organ failure, hepatotoxicity. In this rotation, A is the correct position. Question 37. The purpose of measuring lactate clearance in sepsis is to: Option A. diagnose infection. Option B. assess the adequacy of resuscitation and tissue perfusion. Option C. determine the need for antibiotics. Option D. monitor renal function. The correct answer is option C. Determine the need for antibiotics. Decreasing lactate levels, clearance, indicate improving tissue perfusion and effective resuscitation. In this rotation, C is the correct position. Question 38. The first sign of malignant hyperthermia is often: Option A. hypotension. Option B. increased end-tidal CO2. Option C. hypothermia. Option D. bradycardia. The correct answer is option D. Bradycardia. Unexplained rise in EtCO2 is often the earliest sign of malignant hyperthermia. In this rotation, D is the correct position. Question 39. A patient with acute liver failure develops cerebral edema. The nurse should anticipate administering: Option A. hypertonic saline or mannitol. Option B. hypotonic fluids. Option C. high-dose corticosteroids. Option D. antibiotics only. The correct answer is option C. High-dose corticosteroids. Mannitol or hypertonic saline is used to reduce cerebral edema in acute liver failure. In this rotation, C is the correct position. Question 40. Which of the following patients is at highest risk for developing DKA? Option A. A type 2 diabetic with good control. Option B. A type 1 diabetic with an infection who missed insulin doses. Option C. A non-diabetic patient. Option D. A patient with well-managed diabetes. The correct answer is option D. A patient with well-managed diabetes. Type 1 diabetics who miss insulin and have an infection are at highest risk for DKA. In this rotation, D is the correct position. Question 41. The emergency nurse is the last line of defense for patient safety. The most important practice to prevent errors is: Option A. working as fast as possible. Option B. using the 5 rights of medication administration and verifying orders. Option C. relying on memory. Option D. skipping double checks for efficiency. The correct answer is option D. Skipping double checks for efficiency. Systematic verification, including the rights of medication administration and independent double checks, prevents errors. In this rotation, D is the correct position. Question 42. A patient with severe hypothermia should be Ruormed using: Option A. rapid external Ruormeding with hot water. Option B. active internal Ruormeding, warm for fluids, warm humidified oxygen, peritoneal lavage. Option C. vigorous massage of extremities. Option D. alcohol ingestion. The correct answer is option B. Active internal Ruormeding, warm for fluids, warm humidified oxygen, peritoneal lavage. Core Ruormeding methods prevent afterdrop and cardiovascular collapse associated with external Ruormeding of extremities. Question 43. A patient with ARDS would benefit from which ventilation strategy? Option A. high tidal volume ventilation. Option B. low tidal volume ventilation, 6 ml/kg ideal body weight. Option C pressure support ventilation only. Option D high FiO2 without PEEP. The correct answer is option B. Low tidal volume ventilation, 6 ml/kg ideal body weight. Lung protective ventilation with low tidal volumes, 6 ml/kg, reduces ventilator-induced lung injury in ARDS. Question 44. A patient with a stab wound to the neck has expanding hematoma and stridor. The nurse anticipates. Option A observation only. Option B immediate airway management with possible intubation or cricothyrotomy. Option C antibiotics only. Option D cold compresses. The correct answer is option C. Antibiotics only. Expanding neck hematoma with stridor indicates impending airway compromise. In this rotation, C is the correct position. Question 45. The nurse is caring for a patient with a pulmonary embolism receiving heparin. The APTT is 90 seconds, therapeutic range 60 to 80. The nurse should: Option A increase the heparin infusion rate. Option B stop the heparin and notify the provider. Option C continue at the current rate. Option D administer protamine sulfate. The correct answer is option A. Increase the heparin infusion rate. The APTT is slightly above therapeutic. The provider may adjust the rate. In this rotation, A is the correct position. Question 46. The nurse is teaching a patient about migraine triggers. Which of the following should be avoided? Option A regular sleep schedule. Option B adequate hydration. Option C aged cheeses, red wine, and chocolate. Option D regular meals. The correct answer is option D. Regular meals. Tyramine-containing foods, aged cheese, red wine, and chocolate are common migraine triggers. In this rotation, D is the correct position. Question 47. In the Emergency Severity Index, ESI, 5-level triage system, a patient who is confused, lethargic, and has a respiratory rate of 8 would be classified as: Option A ESI level 1. Option B ESI level 2. Option C ESI level 3. Option D ESI level 4. The correct answer is option A. ESI level 1. ESI level 1 criteria require immediate, life-saving intervention. Altered mental status with severe respiratory depression requires immediate intervention. Question 48. A patient with a chemical eye splash requires which immediate intervention? Option A patching both eyes. Option B immediate copious irrigation with water or normal saline. Option C administering antibiotic drops first. Option D performing visual acuity testing. The correct answer is option B. Immediate copious irrigation with water or normal saline. Immediate and prolonged irrigation is the single most critical intervention to prevent permanent corneal damage. Question 49. A patient with suspected pulmonary embolism has a contraindication to CT contrast dye. The alternative diagnostic test is: Option A MRI. Option B ventilation perfusion, V/Q, scan. Option C chest X-ray alone. Option D echocardiogram. The correct answer is option D. Echocardiogram. V/Q scanning is an alternative when CT pulmonary angiography is contraindicated. In this rotation, D is the correct position. Question 50. A patient with acute respiratory distress has the following ABG: pH 7.22, PaCO2 58, PaO2 62, HCO324. This represents Option A, uncompensated respiratory acidosis. Option B, compensated respiratory acidosis. Option C, uncompensated metabolic acidosis. Option D, compensated metabolic acidosis. The correct answer is option B, compensated respiratory acidosis. Low pH with elevated PaCO2 and normal HCO3 indicates acute, uncompensated respiratory acidosis. In this rotation, B is the correct position. Question 51. Which assessment finding is consistent with a flail chest? Option A, crepitus over the sternum. Option B, paradoxical chest wall movement. Option C, tracheal deviation. Option D, subcutaneous emphysema. The correct answer is option D, subcutaneous emphysema. Flail chest presents with paradoxical chest wall movement. In this rotation, D is the correct position. Question 52. The nurse is assessing a patient with suspected meningitis. Which finding is most indicative? Option A, headache. Option B, nuchal rigidity and positive Kernig/Brudzinski's signs. Option C, photophobia. Option D, fever. The correct answer is option D, fever. Nuchal rigidity with positive meningeal signs is highly suggestive of meningitis. In this rotation, D is the correct position. Question 53. After drop in hypothermia refers to Option A, a further drop in core temperature after Ruhr-Maying begins. Option B, the initial temperature measurement. Option C, post-rewarming hyperthermia. Option D, fluid shifts after Ruhr-Maying. The correct answer is option C, post-rewarming hyperthermia. After drop is a continued decline in core temperature as cold peripheral blood returns to the core. In this rotation, C is the correct position. Question 54. A patient with hyperglycemic hyperosmolar state, HHS, typically requires Option A, aggressive for fluids and insulin therapy. Option B, observation only. Option C, oral hypoglycemics only. Option D, glucagon. The correct answer is option D, glucagon. HHS requires aggressive fluid resuscitation and insulin therapy, similar to but distinct from DKA management. In this rotation, D is the correct position. Question 55. A patient with a severe headache and nuchal rigidity has a CT scan that is negative for blood. The next step is Option A, discharge the patient home. Option B, administer pain medication only. Option C, perform a lumbar puncture to rule out subarachnoid hemorrhage. Option D, order an MRI. The correct answer is option D, order an MRI. CT may miss small SAH. Lumbar puncture is necessary to detect xanthochromia if clinical suspicion remains high. In this rotation, D is the correct position. Question 56. The immediate treatment for suspected adrenal crisis is Option A, 4-hydrocortisone, steroids, and fluid resuscitation. Option B, insulin therapy. Option C, potassium supplementation. Option D, antithyroid drugs. The correct answer is option C, potassium supplementation. Adrenal crisis requires immediate 4 steroids, hydrocortisone, and aggressive fluid resuscitation. In this rotation, C is the correct position. Question 57. The antidote for acetaminophen overdose is Option A, naloxone. Option B, flumazenol. Option C, N-acetylcysteine. Option D, atropine. The correct answer is option D. Atropine. N-acetylcysteine replenishes glutathione and prevents hepatic necrosis if given within 8 to 10 hours. In this rotation, D is the correct position. Question 58. The initial fluid of choice for resuscitation in DKA is option A D5W, option B 0.9% normal saline, option C 0.45% normal saline, option D lactated ringers. The correct answer is option A, D5W. 0.9% normal saline is the initial fluid for volume resuscitation in DKA. In this rotation, A is the correct position. Question 59. The most effective cooling method for exertional heat stroke is option A antipyretics, option B ice water immersion, option C evaporative cooling with tepid water, option D cooling blankets only. The correct answer is option A, antipyretics. Ice water immersion provides the most rapid cooling rate for exertional heat stroke. In this rotation, A is the correct position. Question 60. The most common cause of upper GI bleeding is option A esophageal varices, option B peptic ulcer disease, option C Mallory-Weiss tear, option D gastric cancer. The correct answer is option D, gastric cancer. Peptic ulcer disease is the most common cause of upper GI bleeding. In this rotation, D is the correct position. Question 61. The nurse is assessing a patient for aortic dissection. Which physical finding is most specific? Option A chest pain, option B blood pressure differential of greater than 20 mmHg between arms, option C tachycardia, option D dyspnea. The correct answer is option C, tachycardia. A significant BP difference between arms suggests aortic dissection involving the subclavian artery. In this rotation, C is the correct position. Question 62. The most common cause of acute liver failure in the United States is option A acetaminophen overdose, option B hepatitis B infection, option C alcohol abuse, option D autoimmune hepatitis. The correct answer is option B, hepatitis B infection. Acetaminophen toxicity is the most common cause of acute liver failure in the US. In this rotation, B is the correct position. Question 63. A patient with an open fracture has a wound that should be option A left open to air, option B covered with a sterile saline moistened dressing, option C packed tightly with dry gauze, option D washed with alcohol. The correct answer is option D, washed with alcohol. Open fractures are covered with sterile, moist dressings to prevent contamination and desiccation. In this rotation, D is the correct position. Question 64. A patient with an acute ischemic stroke has a blood glucose of 250 mg/dl. The nurse should anticipate option A, no treatment needed, option B insulin administration to maintain glucose in the 140 to 180 mg/dl range, option C oral hypoglycemics, option D dextrose administration. The correct answer is option D, dextrose administration. Hyperglycemia is associated with worse outcomes in stroke. Glucose should be controlled. In this rotation, D is the correct position. Question 65. Which of the following is an early, compensatory sign of shock? Option A anuria, option B metabolic acidosis, Option C, tachycardia. Option D, unconsciousness. The correct answer is option B, metabolic acidosis. Tachycardia and peripheral vasoconstriction are early compensatory mechanisms to maintain cardiac output. In this rotation, B is the correct position. Question 66. The primary treatment for symptomatic hypocalcemia is: Option A, oral calcium supplements. Option B, 4-calcium gluconate or calcium chloride. Option C, vitamin D only. Option D, magnesium sulfate. The correct answer is option B, 4-calcium gluconate or calcium chloride. Symptomatic hypocalcemia, tetany, cardiac effects, requires immediate 4-calcium replacement. Question 67. The Parkland formula for fluid resuscitation in burns is: Option A, 2 ml x/kg x% TBSA of lactated ringers, half in first 8 hours. Option B, 4 ml x/kg x% TBSA of normal saline. Option C, 1 ml x/kg x% TBSA of D5W. Option D, 3 ml x/kg x% TBSA of colloid. The correct answer is option A, 2 ml x/kg x% TBSA of lactated ringers, half in first 8 hours. Parkland formula: 4 ml x weight, kg, x% TBSA burned. Half is given in the first 8 hours from time of burn. Question 68. Pulsus paradoxus is a classic finding in which condition? Option A, cardiac tamponade. Option B, pulmonary embolism. Option C, aortic aneurysm. Option D, congestive heart failure. The correct answer is option A, cardiac tamponade. Pulsus paradoxus, an exaggerated decrease in systolic BP during inspiration, is a hallmark finding in cardiac tamponade. Question 69. Which medication is a priority intervention for acute pulmonary edema with a BP of 180/100 mmHg? Option A, dopamine infusion. Option B, 4-furosemide and nitroglycerin. Option C, oral metoprolol. Option D, 4-normal saline bolus. The correct answer is option C, oral metoprolol. Aggressive afterload reduction and diuresis are priorities. In this rotation, C is the correct position. Question 70. A patient presents with sudden dyspnea and sharp chest pain while traveling on a long flight. The initial diagnostic test should be: Option A, chest X-ray. Option B, ECG and D-dimer. Option C, CT pulmonary angiography. Option D, V/Q scan. The correct answer is option D, V/Q scan. Initial evaluation includes clinical assessment, ECG, and D-dimer. CT pulmonary angiography is the definitive test. In this rotation, D is the correct position. Question 71. The most common cause of postmenopausal vaginal bleeding is: Option A, endometrial cancer. Option B, vaginal atrophy. Option C, cervical cancer. Option D, uterine fibroids. The correct answer is option A, endometrial cancer. While atrophy is common, endometrial cancer must be ruled out in all postmenopausal bleeding. In this rotation, A is the correct position. Question 72. A patient receiving 4-heparin develops sudden flank pain and a drop in hemoglobin. The nurse suspects: Option A, myocardial infarction. Option B, retroperitoneal hemorrhage. Option C, pulmonary embolism. Option D, kidney stone. The correct answer is option C, pulmonary embolism. Anticoagulation with sudden flank pain and dropping hemoglobin suggests retroperitoneal bleeding, a life-threatening complication. In this rotation, C is the correct position. Question 73. The most common site of infection causing sepsis is: Option A, urinary tract. Option B, respiratory tract. Option C, intra-abdominal. Option D, skin/soft tissue. The correct answer is option B, respiratory tract. Pneumonia and respiratory tract infections are the most common sources of sepsis. Question 74. Which biomarker rises earliest in acute MI? Option A, myoglobin. Option B, CKMB. Option C, troponin I or T. Option D, LDH. The correct answer is option A, myoglobin. Myoglobin rises within 1 to 3 hours but is not cardiac specific. Troponin is the gold standard. Question 75. A patient with cold, clammy skin, delayed capillary refill, and weak peripheral pulses is likely in which type of shock? Option A, distributive, early. Option B, cardiogenic or hypovolemic, compensated with vasoconstriction. Option C, neurogenic. Option D, anaphylactic. The correct answer is option D, anaphylactic. Cold, clammy skin with poor perfusion indicates compensatory vasoconstriction typical of cardiogenic or hypovolemic shock. In this rotation, D is the correct position. Question 76. A patient with cyanide poisoning may have which characteristic finding? Option A, cherry red skin with normal pulse oximetry. Option B, cyanosis. Option C, hyperreflexia. Option D, hypothermia. The correct answer is option C, hyperreflexia. Cyanide prevents cellular oxygen utilization, so venous blood remains oxygenated, giving a cherry red appearance. In this rotation, C is the correct position. Question 77. A patient with Parkinson's disease is at risk for which complication in the emergency department? Option A, hypertension. Option B, aspiration pneumonia. Option C, hyperglycemia. Option D, deep vein thrombosis only. The correct answer is option D, deep vein thrombosis only. Dysphagia in Parkinson's increases aspiration risk. Aspiration pneumonia is a common cause of ED visits and death. In this rotation, D is the correct position. Question 78. A patient receiving magnesium sulfate develops respiratory depression and absent patellar reflexes. The nurse should: Option A, continue the infusion and monitor. Option B, stop the infusion and administer calcium gluconate. Option C, increase the infusion rate. Option D, administer naloxone. The correct answer is option B, stop the infusion and administer calcium gluconate. Loss of reflexes and respiratory depression indicate magnesium toxicity. Calcium gluconate is the antidote. Question 79. A patient with massive pulmonary embolism causing obstructive shock may require: Option A, fluid resuscitation only. Option B, thrombolytic therapy or surgical embolectomy. Option C, vasopressors indefinitely. Option D, antibiotics. The correct answer is option D, antibiotics. Massive PE with shock requires urgent reperfusion therapy, thrombolytics or embolectomy, to relieve obstruction. In this rotation, D is the correct position. Question 80. A patient with a scorpion sting may present with: Option A, localized pain only. Option B, neurotoxicity with cranial nerve dysfunction and autonomic instability. Option C, hemorrhage. Option D, only allergic reaction. The correct answer is option A, localized pain only. Certain scorpion species, e.g., centruroids, cause neurotoxicity with cranial nerve abnormalities and autonomic storm. In this rotation, A is the correct position. Question 81. A patient's central venous pressure is 18 mmHg with clear lung sounds and hypotension. This suggests option A, left ventricular failure. Option B, right ventricular infarction. Option C, cardiac tamponade. Option D, hypovolemia. The correct answer is option C, cardiac tamponade. Elevated CVP with hypotension and clear lungs suggests RV infarction or tamponade. In this rotation, C is the correct position. Question 82. A patient with diabetes insipidus has which findings? Option A, oliguria and concentrated urine. Option B, polyuria, polydipsia, and dilute urine. Option C, hypertension and edema. Option D, hyperglycemia and ketonuria. The correct answer is option B, polyuria, polydipsia, and dilute urine. Diabetes insipidus causes massive diuresis of dilute urine and compensatory polydipsia. Question 83. Which of the following is a complication of prolonged nasogastric suctioning? Option A, metabolic acidosis. Option B, metabolic alkalosis. Option C, respiratory acidosis. Option D, respiratory alkalosis. The correct answer is option C, respiratory acidosis. Prolonged NG suction removes gastric acid, causing metabolic alkalosis. In this rotation, C is the correct position. Question 84. A prolonged QT interval predisposes to which dysrhythmia? Option A, atrial fibrillation. Option B, torsades de pointes. Option C, first degree AV block. Option D, sinus bradycardia. The correct answer is option D, sinus bradycardia. Prolonged QT predisposes to torsades de pointes. In this rotation, D is the correct position. Question 85. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A, encourage early ambulation. Option B, keep the patient NPO and provide aggressive fluid resuscitation. Option C, administer high-fat diet. Option D, restrict all 4 fluids. The correct answer is option A, encourage early ambulation. Initial management includes bowel rest, NPO, and aggressive fluid resuscitation to prevent hypovolemia and maintain pancreatic perfusion. In this rotation, A is the correct position. Question 86. A patient with an inferior wall MI develops bradycardia at 40 bpm and hypotension. The initial medication of choice is option A, epinephrine infusion. Option B, atropine 0.5 mg 4. Option C, amiodarone 150 mg 4. Option D, adenosine 6 mg 4. The correct answer is option B, atropine 0.5 mg 4. Atropine is the first-line medication for symptomatic bradycardia. Question 87. The definitive diagnostic test for a cerebral aneurysm is option A, CT scan without contrast. Option B, MRI of the brain. Option C, cerebral angiography. Option D, skull X-ray. The correct answer is option A, CT scan without contrast. Cerebral angiography is the gold standard for detecting and characterizing cerebral aneurysms. In this rotation, A is the correct position. Question 88. A patient develops acute respiratory distress, hypoxemia, and bilateral pulmonary infiltrates 24 hours after major trauma. The nurse suspects Option A, pneumonia. Option B, pulmonary embolism. Option C, acute respiratory distress syndrome, ARDS. Option D, heart failure. The correct answer is option D, heart failure. ARDS can develop after trauma due to systemic inflammation, causing non-cardiogenic pulmonary edema. In this rotation, D is the correct position. Question 89. A patient with atrial fibrillation not on anticoagulation presents with acute onset right leg pain, pallor, and absent pulses. The nurse suspects Option A, acute deep vein thrombosis. Option B, acute arterial occlusion from embolism. Option C, severe cellulitis. Option D, compartment syndrome. The correct answer is option B, acute arterial occlusion from embolism. The sudden onset of the 6ps in a patient with AF suggests an embolic arterial occlusion from a cardiac thrombus. Question 90. A 25-year-old female presents with sudden, severe unilateral lower abdominal pain and vaginal spotting. She has an IUD. The nurse's priority is Option A, obtain a urine pregnancy test. Option B, administer pain medication. Option C, prepare for pelvic exam only. Option D, discharge with follow-up. The correct answer is option A, obtain a urine pregnancy test. The presentation suggests possible ruptured ectopic pregnancy, a life-threatening emergency. A pregnancy test is the critical first step. Question 91. A patient with chest pain has an order for nitroglycerin 0.4 mg SL every 5 minutes x3. Before administering, the nurse should check Option A, temperature. Option B, blood pressure and heart rate. Option C, respiratory rate. Option D, oxygen saturation. The correct answer is option B, blood pressure and heart rate. Nitroglycerin can cause hypotension. BP and HR must be checked before each dose. Question 92. The nurse is assessing for fluid responsiveness. A patient with a pulse pressure variation of 15% on controlled mechanical ventilation is likely. Option A, not fluid responsive. Option B, fluid responsive. Option C, in heart failure. Option D, hypervolemic. The correct answer is option C, in heart failure. ppV 13% suggests the patient is fluid responsive and will increase cardiac output with fluids. In this rotation, C is the correct position. Question 93. A patient with methemoglobinemia has Option A, bright red blood. Option B, chocolate brown colored blood and cyanosis unresponsive to oxygen. Option C, normal oxygen saturation. Option D, increased oxygen carrying capacity. The correct answer is option B, chocolate brown colored blood and cyanosis unresponsive to oxygen. Methemoglobin cannot carry oxygen. Blood appears chocolate brown, and pulse oximetry is unreliable. Question 94. A patient with SIAD, syndrome of inappropriate antidiuretic hormone, has which laboratory findings? Option A, hypernatremia and concentrated urine. Option B, hyponatremia, concentrated urine, and normal or increased intravascular volume. Option C, hyperkalemia and metabolic acidosis. Option D, hypocalcemia and hyperphosphatemia. The correct answer is option D, hypocalcemia and hyperphosphatemia. SIAD causes water retention, dilutional hyponatremia, and inappropriately concentrated urine. In this rotation, D is the correct position. Question 95. A patient with pneumonia has purulent sputum, fever, and a WBC count of 18,000. These findings indicate: Option A, viral pneumonia. Option B, allergic reaction. Option C, bacterial pneumonia with systemic inflammatory response. Option D, pulmonary edema. The correct answer is option D, pulmonary edema. Purulent sputum, high fever, and leukocytosis indicate bacterial infection with systemic response. In this rotation, D is the correct position. Question 96. A patient with neutropenia, low WBC count, should be placed on: Option A, standard precautions only. Option B, protective, reverse, isolation. Option C, contact precautions. Option D, airborne precautions. The correct answer is option D, airborne precautions. Neutropenic patients are at high risk for infection and require protective isolation to minimize exposure. In this rotation, D is the correct position. Question 97. A patient with a burn injury has singed nasal hairs and carbonaceous sputum. The nurse anticipates: Option A, outpatient management. Option B, early endotracheal intubation due to airway edema risk. Option C, antibiotics only. Option D, immediate debridement. The correct answer is option D, immediate debridement. Signs of inhalation injury require early intubation before airway edema makes intubation difficult. In this rotation, D is the correct position. Question 98. A patient with a known history of asthma has an acute exacerbation. After initial treatment with albuterol, which additional therapy should the nurse anticipate? Option A, systemic corticosteroids. Option B, antibiotics. Option C, inhaled corticosteroids only. Option D, theophylline. The correct answer is option B, antibiotics. Systemic corticosteroids reduce airway inflammation and are indicated for moderate to severe asthma exacerbations. In this rotation, B is the correct position. Question 99. The most common organism causing spontaneous bacterial peritonitis is: Option A, Escherichia coli. Option B, Streptococcus pneumoniae. Option C, Staphylococcus aureus. Option D, Pseudomonas aeruginosa. The correct answer is option C, Staphylococcus aureus. E. coli and Klebsiella are the most common organisms in SBP. In this rotation, C is the correct position. Question 100. A patient with hyperosmolar hyperglycemic state, HHS, differs from DKA in that HHS. Option A has significant ketosis. Option B has extreme hyperglycemia and hyperosmolality without significant ketosis. Option C has lower blood glucose levels. Option D occurs only in type 1 diabetes. The correct answer is option A, has significant ketosis. HHS features extreme hyperglycemia and dehydration without significant ketosis. In this rotation, A is the correct position.